Hi, my name is Dr. Matt Winter and I am a urological surgeon. I am pleased to welcome you to this video discussing TURP, HoLEP, or green light prostatectomy. The prostate is a walnut-sized gland that sits at the base of the bladder. The urethra travels from the tip of the penis through the prostate and into the bladder. As such, the prostate is located between the bladder and penis and completely surrounds the urethra. The prostate gland is only found in males, and the function of the prostate is to assist with the passage of semen to make fluid to nourish the sperm for its passage along the vaginal tract. As men age, the prostate gland can enlarge. The name given to an enlarged prostate gland is BPH, or benign prostatic hyperplasia. This can result in blockage of urine flow. What are the indications for surgery for BPH? It's when you've failed medical management, medications are no longer controlling symptoms, urinary retention, bladder stones, urinary tract infections, blood in the urine caused by large vessels located on the prostate, or kidney dysfunction. A TURP, HoLEP, or PVP is a procedure whereby we shave away part of the prostate which blocks urine flow. The operation is often called a rebore operation, where the core of the prostate is removed to open the water pipe. This helps the bladder to empty urine more effectively. The operation is performed by the urethra and involves no cuts in the skin. The procedure is carried out under general anesthesia or spinal anesthetic. After anesthesia is performed, antibiotics will be given and your legs will be placed in stirrups. This allows access to the prostate and the urethra. A cystoscopy is then performed. A cystoscope is a telescope that allows me to see inside the urethra and the bladder. If any abnormality is found within the bladder, a biopsy will be taken and a sample sent to the lab. A resectoscope is a special cystoscope that allows me to remove tissue. That will then be inserted into the urethra to allow the removal of the prostate tissue which is blocking the urethra. A TURP. A TURP uses electrical energy to shave away the prostate. A HoLEP, or a holmium enucleation of the prostate, or PVP, otherwise known as green light laser, uses laser energy to remove the prostate. Overall, a laser prostatectomy is associated with slightly longer operation time, reduced bleeding or catheterization and length of stay, but the efficacy is very similar and sexual function is also very similar when compared to a TURP. The operation will approximately take 1 hour to complete, and I offer all 3 treatment options. In select patients, a suprapubic catheter may be inserted at the same time as the rebore operation. This is often recommended as a backup form of drainage while your bladder improves its ability to contract after the procedure. A suprapubic catheter is inserted above the pubic bone into the bladder via a small cut in the skin. I will inform you whether or not I recommend that prior to the operation. After enough prostate tissue has been removed via the urethra to unblock the flow of urine, the tissue will then be collected and sent to the laboratory. Only a TURP or TURP and HoLEP result in tissue being sent. A PVP or green light laser vaporizes the tissue, rendering it unable to be analyzed. A catheter will be inserted into the bladder via the urethra at the conclusion of the operation, and fluid will continuously flow through the catheter to help stop bleeding and prevent any blood clots blocking the catheter. The catheter may cause some mild irritation of the bladder and some discomfort at the tip of the penis. This is very normal. The catheter may also cause some spasms, which will make you feel like you need to pass urine. And you may also get a small bit of leakage around the catheter. These spasms are unpleasant, but do not cause long-term damage. If they occur, please contact the nurse and we'll be able to assist in irrigating the catheter to help give you some relief and reduce the spasms. We've also got some medications to help reduce spasms while the catheter is in. You will spend approximately 1 to 2 nights in hospital, with the catheter being removed the morning of your anticipated discharge day. We will perform bladder scans after the catheter is removed to ensure you are emptying your bladder sufficiently. We are generally satisfied when you urinate a greater volume than you have left behind in your bladder. What are the indications for surgery for BPH? When you have failed medical therapy, when medications are no longer controlling your symptoms, when you have significant urinary symptoms, you've had urinary retention, bladder stones, urinary tract infections, blood in the urine caused by large vessels located on the prostate, when you have kidney dysfunction caused by high bladder pressures secondary to long-standing BPH. A TURP should improve your flow of urine, relieve the symptoms of your BPH, and relieve the strain placed on your bladder. A PVP and HoLEP will also do the same thing. Judge the success of the operation at 2 to 3 months, as it will take some time for your bladder to readjust. As with any surgical procedure, there are risks involved. The general risks of surgery include anesthesia-related issues. Your anaesthetist will discuss in greater detail. Bleeding during the operation, which may require a blood transfusion, blood clots in the legs, deep vein thrombosis, lungs, pulmonary emboli, or brain stroke. Heart or lung problems, e.g. abnormal heart rate, rhythm, chest infection, collapsed lung may occur. Adverse or allergic reactions to medication, damage to nearby structures such as bowel, rectum, or blood vessels. Infection, blood, urine, or wound. The specific risks of TURP, HOLEP, or PVP include bleeding. This can occur early or late, up to 6 weeks after the operation. Less than 1% of patients will require a blood transfusion. Infection. This can occur in up to 1.5%. There may be catheter-related issues, blockage, or catheter dislodgement. TURP syndrome occurs in 1%. It's a syndrome caused by absorption of too much dilute fluid during the operation. TURP syndrome can result in confusion, nausea, slowed heart rate, rhythm, and seizures. This syndrome only occurs during a TURP, and it is quite rare. Irritative voiding symptoms sometimes is worse in HOLEP or PVP. You may be unable to urinate when the catheter is removed. If this is the case, you will require another catheter in order to go home and then return in a week for another trial to remove the catheter. Retrograde ejaculation will occur in 80 to 100% of patients. This means that when you ejaculate, the sperm will not pass out of the penis, it will pass back into the bladder. You will then pass the sperm out during the next urination. This should not affect your ability to achieve an orgasm. Erectile dysfunction can occur in 1 to 5%. Bladder neck contracture, which is scarring around the bladder neck, can occur in 1.5%. And a urethral stricture can also occur, which is scarring within the urethra. Bladder neck contracture and urethral stricture may not surface until many years later and will often require a procedure to open up the water pipe. Incontinence is rare and occurs in less than 1%, and the need for redo surgery is 10% at 5 years. What are the alternatives? A rebore operation is not an essential procedure for most men. Conservative management and medications are often the first line therapy. However, these medications are rarely a permanent long-term solution and can be associated with their own side effects. I offer the following alternative surgical treatments for BPH: Urolift, aquablation, and robotic simple prostatectomy. The particular choice for what is the best treatment for you and your prostate will depend on your preference, your prostate size, and your current medical problems. I will discuss in detail during your consultation. You can expect to have intermittent passage of red urine or small clots for up to 6 weeks after your TURP, HOLEP, or green light laser prostatectomy. You'll also notice what looks like tiny pieces of tissue in your urine after the operation for the first couple of weeks. Do not be alarmed. This is just tiny bits of prostate tissue sloughing off. This is expected outcome but will fully resolve. Initially, you may experience burning during urination, a loss of some control of urination, or need to urinate frequently. These symptoms are normal and will eventually settle down. It may take a few weeks to months for you to notice improvement in your urine flow. You should judge the success of your operation at approximately 3 months. We advise you to avoid straining, strenuous activity, or exercise or heavy lifting for up to 4 weeks post-operation and gradually build up your activity levels. You may return to work after the first week post-operation, providing you do not perform any heavy lifting. At the 4 to 6 week mark, you should be able to return to full activities. Most patients are discharged after 1 to 2 nights stay in hospital. The catheter will be removed on the day of your discharge. If you fail to pass urine after the catheter is removed, a new catheter will be placed, and I will arrange for that catheter to be removed in 1 week. To be ready for discharge, you should be walking, tolerating food, and comfortable. I advise a close friend or family member to be with you for the first couple of hours or days at home until you are managing well. I will arrange for any prescriptions for home. If you are discharged with a Foley catheter, you can walk, shower, and perform most activities of daily living while the catheter is in. Small amounts of urine may leak around the catheter. This is normal, providing a majority of the urine is draining inside the catheter. Please place a pad around the catheter and the penis to soak up any leakage. You can return to work when you feel up to it. Some patients choose to work with the catheter still in. You can start to exercise and lift weights after 4 to 6 weeks. you will need to make a follow-up appointment with me in the office at 4 to 6 weeks after the procedure. It is important to notify my office or attend the emergency department if you develop any bleeding that is getting heavier, not lighter, you develop a fever, you have problems passing urine, or worsening pain. I hope you found this video informative, and I trust it has better equipped you and your family to prepare for your upcoming operation. I am available to answer any questions you may have, or you can contact my office if you have any concerns. I look forward to helping you resolve your urological problems, performing the operation, and caring for you during the recovery.